The worst part about being a nurse is not when, let's see, when you have a vag bleed in the ER, not me personally, but a patient, and she stands up to go over to the commode and a clot the size of a kidney just falls out onto the floor. Um, I have to say, one of the worst things was I had a patient, he was dead. We got him back a few times, but he was going into disseminated intravascular coagulopathy and DIC, which they say stands for death is coming because it really is. And under his central line, he bled under there, and you could see the little clots and floaties in his blood from the DIC. And I was suctioning his mouth out, and just this thing of blood and snot just like came out with it. And I just handed the suction to the respiratory therapist and turned around. Oh my goodness, that was pretty gross. But the worst thing is, the worst thing about being a nurse is having to support the narrative that you're expected to just go along with. And it's the worst part is not that you're expected to lie basically to your patients. The worst part is you're expected to believe that lie. You are expected to believe, well, I'll tell a story. Okay, I was working at a prison. Most of my time as a nurse has been in critical care, but I worked at a prison for quite a while, and I really enjoyed it. It was like a low security prison, and I was over the women's unit and one of the men's units. There were 3 men's units and 1 women's unit. It was a small prison. It was on a Native American reservation. And we got a new patient or a new inmate, and the nurse practitioner at the prison just continued this girl's statin because it's what her primary care provider had put her on. And nobody had looked at this girl's blood tests recently, I don't believe. And if they had, they certainly didn't look at the other factors that I looked at. I looked and realized she's been prescribed this medication for 1.5 years, but she's never once filled that prescription. So she hadn't been taking it, and she had a cholesterol test done 3 months prior to this date, and her cholesterol was 3 or 4 points higher than the average. It was 4 points above normal, and her HDL, which is your good cholesterol, was a few points low. And so I was like, she's never filled this. 3 months ago, her cholesterol levels were fine. So what I did was I thought, I can't tell her, don't take this. So what I did was I printed off the copy of her blood test, and I went to the manufacturer's website for that statin. Crestor was the one. It was the generic name, but Crestor is the brand name. I don't remember what the generic name of it is. Because I thought to myself, is this the one that can cause rhabdomyolysis? Rhabdomyolysis is when your muscle cells break down and they release something called myoglobin into your bloodstream. And this happens on a very small scale when you exercise, but your kidneys can filter out a small amount of myoglobin, but a massive flood of myoglobin will wreck your kidneys permanently. I'm talking on dialysis for the rest of your life, if not dead right there. DRT, as we say in the business. And yes, it was. On the manufacturer's website, it said if you have muscle soreness, discontinue this. Stop taking it immediately. Call your prescriber. Blah blah blah. This could be something called rhabdomyolysis that will lead to kidney failure and death. And so I went over to the unit. I put the medication in her Mediset, which is the little thing with the Sunday, Monday, Tuesday, and then morning, afternoon, dinner, bedtime. I put it in there at nighttime, and I had the corrections officer on the unit summon her, and she came out, and I said, okay, see this little red pill in your Mediset? I said, this is your cholesterol medication that just got prescribed to you. Have you ever taken this medication before? No. I said, it's been prescribed to you for a while. You've never filled it and taken it. She said, no, I've never taken it. I said, okay, I'm glad I know that. I said, I am supposed to tell you to take this. You're supposed to take it, but I also, as your nurse, I have to advocate for you. And I'm obligated morally to tell you, you don't have to take this. We can't make you take anything. You have a right to refuse whatever you choose to refuse. And so I'm just going to educate you about this medication so that you can make the decision. See, that's my code. That's what I'm all about. That's what I'm doing is all about. I want people to make their own decisions, an informed decision. Back to the story. Okay, so I basically just ran right through it with her, said, it's this little tiny red pill. This was your cholesterol test. You know, you were 3 points high here, 2 points low here. Take some fish oil and do some exercise, and these numbers will go right where they should be. And then I showed her the side effects, and I pointed out, I said, these were on the manufacturer's website. That means that this pharmaceutical company, which has billions of dollars at their disposal, it means these side effects are so well documented that they could not legally fail to list them on their website because these are so well proven that this medication can cause these. I said, so it's this little red pill. You should take it, but you don't have to. And I got in trouble for that. So that kind of tells you a little bit about why being a nurse really sucks sometimes.